Hi, everybody. I am Dr. Elena Shea. I am a pediatrician at Farrell Pediatrics in Reston, Virginia, and I'm here today to talk about breastfeeding. So today's talk is called Breastfeeding 411, debunking those common myths that we see kind of all over the internet. So this is a little bit about me. Again, my name is Elena Shea. I'm a board certified general pediatrician, board certified in breastfeeding medicine. I'm an IBCLC. I got 3 kiddos. This is a picture from a couple of years ago. I have an adult bonus son. I had postpartum with my 2 older ones. I love to travel. I love to read. I love being outside. Um, and I love educating about breastfeeding. So this is our first myth. Let me move my little picture. So myth 1, breastfeeding is natural. I get this all the time when moms come in to talk to me. They tell me how hard it is. They didn't expect it to be so hard. Why are they failing? And there's a lot that goes into this about why breastfeeding can be so difficult. But these are sort of things that we hear a lot. It's supposed to be easy. It's supposed to be um, natural, and I'm the only one who's having a hard time. But the truth is that there is a learning curve when it comes to breastfeeding. There's a lot of learning that we used to do at the feet of our mothers and aunts and grandmothers as they nursed their babies, that we just don't have anymore. So I always tell moms who are having a hard time, this is natural the way walking is, not the way breathing is, right? We breathe without thinking, but there is a learning step-by-step process in learning how to walk. And so when you think of breastfeeding that way, then sometimes it can make it a little bit less hard if we're having, a difficult time with it. You are not alone. This is really important for all these things. If any of these sort of resonate with you, you're not the only one going through this. I see patients every day who are having, some of these things going on. So, myth number 2, breastfeeding is all or nothing. That is not true. We know that human milk for human babies is ideal. It's made perfectly for your baby, but formula is a medical miracle. There's lots of reasons people choose to formula feed, either exclusively or as part of their feeding journey with breast milk, and all those things are okay. What we really want is the baby to get fed and for mom to be obviously happy with whatever decision that she makes. Myth number 3 is that babies who are bottle fed have all these things. So in this sense, I'm talking about babies who are being bottle fed breast milk for the first couple ones. And then anyone who's bottle feeding, including, formula or pumped milk. So if you are providing breast milk to your baby via bottle or breast or however you're doing it, your partner's doing the feeds, then you are nursing. You're just pumping and nursing. Babies get all the benefits from human milk, whether they get it from a bottle or from the breast. So they are getting those immune boosters, they're getting all those good fats for their brain, all those sort of things. And anyone who bottle fed knows that you bond just as much with your baby, whether you are nursing them to breast or you're doing a bottle. I nursed 3 kids, 2 to breast, 1 exclusively pumped, and you know what? They're all as attached to me as the other ones are. So I, really focus on that. You are not doing anything wrong if you choose to bottle feed. So myth number 4, and I hear this a lot, especially on social media, is that it's supposed to hurt. It's okay if it hurts. It's okay if your nipples are traumatized and bleeding and all this stuff. These are the things that we do for our babies. That is not true at all. There is no way we would have evolved to nurse if it was supposed to hurt. We would have come up with another option very, very quickly. Um, the next The next myth is that we breastfeed just for our baby, and we all know those um, things that we are given in breast milk, right? It's the perfect food. It gives you antibodies, it protects against diseases, it promotes healthy weight. It will help adapt babies to the outside world, outside the mom's body, promotes brain development with all those good fats. I mean, these are the things that when people talk about breastfeeding, they emphasize as why we should do it. And all of them are true, and I agree with them. But there's lots of benefits to moms as well. Lots of research shows that moms who nurse recover from delivering easier. It can be protective against postpartum mood and anxiety disorders. So we'll talk a little bit more about that after. Can reduce cancer risks, protects against heart disease and diabetes. Arguably, it's cheaper because you don't have to deal with bottles and all that stuff and buying formula. So, should you pump and dump? So, most moms at some point after they have their baby, and before they are done nursing, will have something done to them or given to them, and they're told, this is really bad for the baby, you should pump and dump. And what that means is you should remove breast milk while you're on this medication or after this procedure, and then dump it down the sink. And if anybody has ever pumped or nursed a baby, you know that that is like a knife to the heart to have to give up your milk that you worked so hard to get. But that is kind of what a lot of providers will tell you. But the truth of the matter is that there's very, very few medications that you cannot nurse while on or having received. Big ones are narcotics because they can cause sleepiness in mom, but also because the narcotics can get into the milk and make babies sleepy. Chemotherapies, um, and then a very, very handful. So I always will encourage moms who are nursing who tell me they're getting a procedure. I was like, well, talk to the anesthesiologist, talk to your surgeon. This is the great website that you can check out to see if the medicine that you're getting is actually not okay. Because in a perfect world, we want breastfeeding to be as easy for everyone without adding all these hurdles to it. Yep. This is a big one. So myth number 7, I need a freezer stash. And I'm sure if you've been on social media and at all follow anyone who is kind of into nursing or is a new mom, they'll show you these pictures of a deep freezer with tons of milk. Or they'll say, I had to go buy a freezer because I'm making so much milk. And there's this idea that this is what we should be doing. We should be feeding our baby and storing so much milk in our freezers, but that's not true, right? If we look at other mammals like this, beautiful little elephant who's feeding her baby, they're not walking around with pumps and deep freezers. Mammals are designed to be exact producers. That means that you make enough milk to feed your baby, um, ruling out other medical things that could affect milk supply. Um, your body will make the milk that your baby needs. No more, or maybe a little bit more, maybe a little bit less, but not ounces and ounces and ounces and ounces extra. That can actually cause lots of problems, and we don't really encourage it within the kind of breastfeeding community. It's called oversupply, right? And these are some of the things that you can get um, from that. And the big ones, that I always like to talk about is pain and then being pump dependent, right? So if you are pumping and feeding your baby, your body thinks you have more than one baby. And if you skip that milk removal, then you get uncomfortable. You get engorged. You could get, clogged ducts and mastitis and all these things that we really don't want people to be having. So those of us within the breastfeeding medicine community work hard on making sure the parents are getting their supply to what it should be, but not be so high that it is causing any of these sort of things. Myth 8 is kind of the flip side of that again, that most women are not making enough milk. And this is kind of one of those things you see prevalent on social media. You have to buy all these supplements. If you don't have a freezer stash, you have undersupply, buy our supplement, buy our teas. And as someone whom, when I had my first baby, I had been doing medicine in pediatrics for close to, 10, 12 years. I fell into this trap and I bought all these supplements and all these milks and teas and all these things. And then I started learning more about what a normal supply is. And I felt duped and upset that I had been told this lie. Um, Again, kind of the same, probably not. Mammals are designed to be exact producers. And I just want to say how amazing this picture is that this dolphin is nursing her baby underwater. I think that's so neat. All right. Myth number 9 is we need to nurse for a certain amount of time. It only is good if you nurse for 6 months or 12 months or 2 or toddlerhood. And that's not true at all. Sorry. The reality is that breastfeeding is dose dependent. A little bit of breast milk for a few days is better than none. Nursing for a couple months is better than none, right? 6 months, 12 months, whenever you feel, all that is great. Any breast milk your baby can get will help them with some of those benefits and will help you. Now, the recommendations is exclusive nursing till 6 months. Then with complementary food, so like you start solids at 6 months and then you continue to nurse, ideally till the age of 2 or for as long as is works for mom and baby. And we all know that it can be hard to continue to nurse when you have to go back to work or you have other kids. I mean, we all know that. So I always tell moms when they talk to me about weaning and feeling like they failed because they didn't make it to that 6 months, 12 months, 2 year, uh, whatever goal they had set to themselves. And I said, well, you've done an amazing job. You've done so much for your baby. Um, be proud of that. Also, a little bit of breast milk long term is better than no breast milk long term. So sometimes what will work for families is they'll decrease the amount of breast milk they're feeding their babies, and the baby's getting a couple bottles a day. They're nursing at home, but getting formula at daycare. All those things are great. They are protective. They do increase the benefits of nursing. So I always tell parents 1 bottle is better than nothing if that is what you have, because it's what you stored in the freezer and now you're done pumping or feeding or whatnot. That's great. Give that to your baby. It can only help. This is a big one too. Myth 10, only bad moms don't nurse, and that's not true. We know that there are lots of reasons that women choose not to nurse, start nursing and then decide to stop. Has a lot to do with how challenging it can be to find breastfeeding support. Um, it can be hard. There's medical reasons, there's mental health reasons, there's lots of reasons that women decide that it's best for their families not to nurse, and that is okay. One of my favorite things to tell families is that healthy parent is more important than breast milk. And those are the decisions that each family needs to make sure that they are providing the overall best for their baby. And this is anyone who has ever heard me talk knows I am a big proponent of long-term breastfeeding support, paid paternal leave, or parental leave, sorry, all the things that we can do to support our moms so that they can nurse if they choose to. Um, that's all I got to say without going too off the rails with that. I want to talk a little bit about postpartum mood disorder. I am also a certified postpartum health counselor through the Postpartum Internet Support International. And I had postpartum with my oldest, who's here. This is the day that I went back to work at 14 weeks postpartum. I look real happy, but I was not really happy. Um, Excuse me. And, here's a picture from my social media. 1 in 5, we know women out there will have postpartum depression or postpartum anxiety. 1 in 10 men will have it as well, or partners, um, which is a new thing that we're starting to kind of really research and dig into when it comes to sort of this postpartum health period. But there is some links between breastfeeding and postpartum mood and anxiety disorder. Biggest being that having a successful breastfeeding journey is protective against getting PMADs, while struggling can exacerbate or make worse underlying anxiety, underlying postpartum mood disorders, which I think is a really important thing to keep in mind when we talk about supporting our moms in whatever decisions they make, supporting our parents and families, because we know that families that are supported tend to have less incidences of PMADs. And those who do have PMADs and are supported, it gets less bad. So my number one advice, I get this question a lot. You see babies all the time, you see parents all the time. What's your number one advice? My number one advice is generally stay off social media. I think social media is great and has a role in life now, but I think trying to get breastfeeding advice, or even parenting advice, especially that 4th trimester parenting advice from social media can be quite challenging. I think making sure that you are following accounts of people who are certified, who are either IBCLCs, so internationally board certified lactation consultants, or CLCs, which are certified lactation counselors, or this growing number of us doctors who are board certified in breastfeeding and lactation medicine. I think those are the people that generally will have really good advice. I think following a parent influencer with no education in breastfeeding and getting advice from her can be very hard, because it's not always correct and it can make us feel bad. And this is totally based on my own personal experiences, from social media and having babies. But really, again, this is the thing I emphasize all the time. Babies need healthy mothers, healthy parents, healthy families more than they need breast milk. Um, because a healthy home and a healthy mom makes healthy babies. Um, and these are just my two big ones when they were much younger. Great. That is my chat on breastfeeding myths. I would love to hear your thoughts. Have you heard these? Are they things that you worried about when you nurse, or are worried about now that maybe you're waiting to have your baby? Are you relieved to hear some of these answers as you prepare to either nurse your next kiddo, or whatever it is? I would love to hear all your comments in the comment section of the video. If you have any specific questions, definitely put them into the comment section, because we can make more videos. So if you have enough questions or issues or topics that you would like us to talk, whether about breastfeeding or medicine or whatever it is, put them into the comment section and we will make a video about them. And that's all I got. Remember to follow us so that you can get notified whenever we put more of these videos up. Thank you.